Welcome to the very first episode of my new series, Ask the Psychiatrist. This is where I'll be answering your real questions from real people. Honestly, openly, and with the research and the experience to back it up. I'm hoping this will be the first of many conversations we have together, so if you have any questions you've always wanted to ask a psychiatrist, big or small, drop them in the comments below. And who am I, by the way? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And answering questions is literally my job, so I better be getting paid for this. All right, question number 1. How long does Adderall XR stay in breast milk? This is from Caroline on Instagram. Caroline, really good and important question we got here. Adderall XR, which is a mix of amphetamine salts, does pass into the breast milk, and it stays there for over 24 hours after you take it. If you're taking a low dose, like under 45 milligrams per day, research shows no known harmful effects on babies. But if you're on a higher dose, like you mentioned in your message, there's more exposure, and that can be risky for the baby. Things like fussiness, poor feeding, overstimulation. The general rule with stimulants like Adderall is, because it hangs out in the breast milk for over 24 hours, if you stop, it would take at least a day or two for your milk to be clear again. Some experts even suggest that if you're taking higher doses, you might need to pump and dump during that time just to be safe. And honestly, you're doing the right thing by thinking ahead. Because when it comes to pregnancy and breastfeeding, the safest route is usually to taper off stimulants with your doctor's help. On the flip side, there can be benefits to taking stimulants during pregnancy and or during breastfeeding. Stimulants can provide you with the energy and focus to be able to provide the best care for your baby, as we know that there is more risk of harm when mom is not functioning the best. Like I always say to my pregnant patients, happy mommy equals happy baby. All right, question number 2. Is it true that long-term use of benzodiazepines can affect cognitive functioning? This is from Dr. Lena Haji, also on Instagram. Dr. Haji, it's great to hear from you. Love this question. P.S. If you want to hear more from Dr. Haji and her role as a forensic psychologist, check out our conversation via the card above. Back to the benzos. All right, the short answer is yes, that it can. Long-term daily use of benzos, things like Xanax, Klonopin, Ativan, they are linked with problems in memory, attention, executive functioning, processing speed, even motor coordination. There's one big meta-analysis found that long-term users had impairments across basically every domain that they studied. Another study showed about 20 to 30% higher risk of cognitive decline. For some people, those effects last even 6 to 10 months after stopping them. There's even some concern about increased dementia risk, up to 78% higher, although that part is still being debated. The bottom line, if the dose is low and the treatment is short-term or closely monitored, it's usually safer. But long-term, high-dose daily benzo use can absolutely affect how you think, how you remember, and process information. It's something to be really thoughtful about, and one reason that I always hesitate when prescribing these meds. For more on benzodiazepines, check out the video I made on them via the card above. Question 3. This came in a bunch of different parts, so we'll do part 1 of this. Will stimulant medication change who my child is? Will it affect creativity or personality? It's from Lauren Watson, also on Instagram. Lauren, great to hear from you, and I'm so glad that you asked this. The short answer is no, it shouldn't change who your child is. If stimulant medication is working properly, it should help take the edge off things like distractibility, frustration, impulsivity, but not erase their spirit, humor, energy, or their creativity. Now, if the dose is too high, sometimes kids can seem a little flat or overly quiet, the dreaded zombie effect. That's a sign that we need to adjust. The right dose helps a child become more fully themselves, not less. And about creativity, research actually shows that for many kids with ADHD, stimulant meds can enhance creativity because it helps them stay focused enough to actually use their creative abilities. Untreated ADHD sometimes blocks creativity even more by making it hard to finish projects or focus long enough to express ideas. The bottom line is that meds should support, not erase, who your child already is. Question 4. When I take Vyvanse and run later, my heart rate is higher even at slow paces. Should I exercise before I take my meds? Great question. This is from 𝒂𝒂𝒂𝒂, also on Instagram. Love how tuned in you are with your body, 𝒂𝒂𝒂. You're exactly right. Vyvanse, like all stimulants, can raise your resting heart rate and make your body more revved up. So when you run later in the day, your heart rate starts higher and climbs faster, even if you're taking it easy. So exercising before you take Vyvanse is a smart move. Your heart rate will stay closer to normal because you won't have the stimulant effect layered on you. Another tip I sometimes suggest, and you should definitely check with your doctor first, is trying L-theanine. It's a natural amino acid from green tea that can help calm the nervous system a little without sedating you. Some people find that it smooths out the stimulant edge, including the heart rate jump. I usually recommend about 200 milligrams daily, and you can get them off Amazon or your favorite supplement source. For more on the best supplements for ADHD, check out the video I made via the card above. Again. And always, if you ever feel chest pain, dizziness, or major shortness of breath, stop and get checked out by your doctor. Question 5. What are the downsides of being a psychiatrist? We're into some good stuff now. This is from 𝒅𝒐𝒏𝒂𝒂, MD, on Instagram as well. Real talk. Being a psychiatrist is incredibly rewarding, but there are real downsides too. First, you deal with open hostility from things like the anti-psychiatry movement and Scientology. There are literally groups that are built around trying to discredit you. And if you're chronically online like me, it can get real annoying real fast. Second, psychiatry doesn't always get the respect it deserves from big healthcare systems or insurers. We're often treated like an afterthought, even though we're literally saving lives every day. It's one of the main reasons that we are in a constant mental health provider shortage that will never improve during my lifetime. Third, there's growing worry about scope creep. Psychiatry gets treated like it's just managing meds. And there's pressure to replace psychiatrists at times with APPs, advanced practice practitioners like nurse practitioners or physician assistants, without enough training or supervision. And the truth is, psychiatry isn't just about prescriptions. It's about diagnosis, nuance, therapy, and risk management. We'll talk more about this in the last question. Bottom line, you have to love this work enough to push through the misunderstandings and the disrespect, because it's still absolutely worth it. Question 6. What's your take on psychiatric NPs or mid-level providers? This is a great question from Mac Margaret, who is a Psych NP herself, also on Instagram. All right, I'm going to be honest here. I've worked with fantastic psychiatric NPs, providers that I trust, who are sharp, compassionate, and skilled. And when it's a team model with good supervision, it can be great. But that's the problem. There's no standardization right now in Psych NP training. And because of that, the quality of graduates is all over the place. Some are phenomenal, others are dangerously underprepared. Psychiatry isn't just writing prescriptions. It's deep diagnosis, psychotherapy knowledge, complex med management. And a lot of that isn't even covered in many NP curriculums. I believe NPs absolutely have a role with supervision and as part of a team. I'm also firmly against independent practice without oversight. Not because of politics, but because patient safety matters. And honestly, a massive part of my job today is de-prescribing and fixing medication regimens and gross misdiagnosis from patients who are mismanaged before coming to see me by Psych NPs. And because of that, I will never be concerned about my own job security. Thank you so much for watching the first episode of Ask the Psychiatrist. If you learned something new, or if it made you think differently, don't forget to like, comment, subscribe, and share with someone who might need it. And if you have more questions that you want answered, leave them down below. I'd love to cover them in future episodes. Until next time, be safe and be well.